pain is so bad that you can't enjoy life the way you used to, it's time to go see a professional. Carolina Pain Physicians is a full-service pain management facility with doctors who have always called Charleston home. We welcome Dr. Tony Owens Jr. along with Dr. David Hall to tell us about the pain management services they offer. A lot of people these days, young, middle-aged, old, they're in all kinds of different pains. What sort of patients do y'all see there?
Answer that.
Yeah, so we treat all types of pain. Some of the most common types of pain we see is arthritis pain of the back or major joints. Typically for patients like that, we offer either injections, medications if appropriate, or alternative therapies. To give you a better idea of some of the specifics we do, for spine pain from arthritis, we offer a minimally invasive procedure that targets the sensory nerves that can cause the pain. That gives patients long-lasting relief. Then other patients who have knee pain from arthritis, for example, we have an injection we can do that provides long-lasting relief and replaces some of the slippery substance that's normally in the knee and helps prevent pain in those patients.
What differentiates you folks from other areas that somebody would go to, say, you know, I've got pain in my knees. You know, I used to be a runner. I've jumped out of planes for 33 years. Perfectly good planes, by the way, when they were on the ground. But after a while, your knees just, what separates you guys from just a regular physician that you would go to, maybe a family practitioner?
Yeah, and one of the most important things is, in addition to having medical school training and residency training, we actually took the time to go through what's called fellowship training, which means we had an accredited program that teaches us specifically how to treat pain patients appropriately. And that's important because not everyone in Charleston that calls himself a pain specialist is necessarily fellowship trained. So we have that ability to treat folks appropriately and really dig down to what's wrong and then come up with appropriate treatment regimens for them based on that.
So people, if they have knee pains, they can go to their regular family physician, but a lot of times the family physician will refer to you guys so that patient will come over and then you'll do the examination. You talk about injections and so forth. It's changed a whole lot over the last 5 to 10 years. That injection, a lot of times the fluid goes back, and instead of the bone on bone, it gives sort of a lubricating area there, so there's less pain, there's less wear and tear?
That's right, and you're actually injecting a natural substance already in normal joint fluid back into the knee. And that substance will eventually break down, so occasionally it has to be repeated. It's expected to last 6 months to a year, and those can be repeated up to twice a year as needed.
When you talk about arthritis, a lot of people say, well, I've got arthritis here, I got arthritis. What exactly is arthritis?
So, more than one type of arthritis, most common being osteoarthritis, where you just get degeneration in between the bones. You know, the joint space itself just starts to break down. And that degeneration over time, of course, affects the sensory nerves and causes pain.
Wow, a lot of, and it can be excruciating pain sometimes.
Absolutely. It can be.
Yeah. What is the most prevalent pain that you folks see in your office there?
So I think the most prevalent pain that we see is definitely spine pain. So usually the arthritis or the wear and tear type arthritis in the low back. So for that we have, like I was speaking about, some minimally invasive procedures that target the sensory nerves that are causing the pain, and we can get patients a year or more pain relief from that. So.
And sometimes just way too much stress, the way the person's walking incorrectly, their gait is incorrect, and you take all that in consideration. You say, you know, this is in the lower back, this is where it's causing all of this pain, from the legs all the way down to the knees and down into the calves, and it's starting, because there's always a starting area. When somebody comes in and you know, kind of walk us through, I give you a call, I get an appointment, I walk in the door, where do we go from there?
Well, the first and most important step is to correctly diagnose the problem. And I always tell folks we work with each patient individually to develop a treatment plan that's right for them. And I like to pride myself on being patient sensitive as far as preference is concerned. We have several treatment options. I feel like my job is to make sure I properly educate the patient to help them, number one, understand what's wrong with their body, what particular area that we're dealing with, what the specific diagnosis is, and then number two, making sure they know what their treatment options are. You can't have a cookie cutter answer for everybody. Not one particular thing is the right thing for everyone. So I give them that choice. Once they have the education under their belt, then they can make an educated choice for themselves.
Having the choices sometimes relieves a lot of the stress about just going into the office and talking with you guys and sitting down and having that one-on-one conversation. How can folks get a hold of y'all?
So it's easy. Just call our office, 737-0437. Our front office staff will help gather any information needed for an appointment, and we strive to get patients in within the next week.
Oh, wonderful.
So very easy.
Wonderful. Where are you guys located?
Right on Highway 78, right at 78 and Ladson Road.
Wonderful. Thank you so much for coming in today. We do appreciate it. We got more coming up. A little going extra green with Earth Fair in just a moment. Stay with us.